In India is now at 17,656 with over 1,500 cases recorded in the last 24 hours. The death toll in India has risen to 559. 40 deaths were recorded in the past 24 hours, while more than 2,800 people have successfully recovered from the virus. The state of Maharashtra remains the worst affected with more than 4,200 cases. 223 people have lost their lives in the state so far. In the national capital, Delhi, more than 2,000 cases have been confirmed and 45 people have lost their lives. Tamil Nadu and Rajasthan have till now registered close to 1,500 COVID-19 cases. Meanwhile, positive cases in Uttar Pradesh, the most populous Indian state, have surged to 1,176 with 17 deaths. And while Goa and Manipur have managed to wipe out the COVID-19 pandemic from the state, both these states now have no active cases of COVID-19. The doubling rate in India has considerably improved. The Health Ministry has said that the doubling rate is now 7.5 days. This is up from 3.4 days recorded earlier. The doubling rate is the number of days over which confirmed cases double in a country. Kerala and Odisha currently have a doubling rate of 31 days, the best figures among all states. The central government has urged all state governments to enforce the lockdown as per issued guidelines. Well, the COVID-19 outbreak has engulfed the entire world with over 165,000 deaths worldwide. The virus is wreaking havoc in the lives of people. Amid this, the survival stories from some of COVID-19 survivors are giving a real insight to their experiences. Listen in.
I thought I was having very bad anxiety and panic attacks. And then I was in the OR one day and I started with the dry cough and I couldn't breathe. So I went to urgent care and I had a chest x-ray and it came back that I had an upper and lower respiratory infection with abnormal inflammation of the airway.
That was probably around 8 p.m. Sunday night. I started to have coughing fits, and every time I finished a coughing fit, it was couldn't catch my breath. And at that point, I was like, something, again, your body's telling you something is wrong. And I just later that night, it was going around midnight. I was so uncomfortable. I was so panic stricken that I was like, all right, let me call an ambulance and get to a hospital because something's wrong.
Let's address the myth. Clearly, African American people can get it. It's no color to who can get it, no color, no race. And I just want to my African American people, please, wake up. This is real. This can happen to you. This can happen to your family, and everybody don't make it out of the situation how I did. Stay home. Stay home. If it's nothing very serious that you have to go out and get, it can wait. It can wait. Stay home.
In a way, it worked out really well that I didn't know what I had while I was very sick. But then once I started feeling better, I discovered what I had. And now I'm able to do things like donate my antibodies for research studies, which is very nice. So I do feel very lucky that I was able to get tested. I've become, now that I know about the fact that people can transmit it without even knowing it, and while they feel perfectly healthy, I have become a big proponent of physical distancing, as I like to say, keeping yourself physically distant from other people, wearing masks, taking all those precautions.